The Progressive Health Forum, comprising of doctors from various groups, says legal action should be taken against councillors and officials who failed to prevent the cholera outbreak in Hammanskraal, north of Pretoria. At least 17 people, as we said, are confirmed to have died in the area from cholera. There are concerns now over whether water tankers are distributing contaminated water. Tshwane's executive Mayor Cilliers Brink says recent tests on the water supply from taps shows no contamination. However, further tests are being determined and are currently under investigation. Well, to discuss this further, we're now joined via Zoom by Dr. Aslam Dasoo, convener of the Progressive Health Forum. Thank you so much for your time. Just looking at, some of your comments in terms of legal action needed to be taken now. Who do you think should then be held liable in this particular outbreak, Doctor? Doctor, please unmute your mic.
So sorry.
No problem.
Good afternoon. Can you hear me?
I can hear you perfectly.
Let me answer your question first by referencing what the executive mayor said, that they are conducting tests to determine the cause of the outbreak. Well, I think he need not wait for the results of the test. He should take a look around him in his council chambers to find the cause of the cholera outbreak. And I'm not being facetious when I say this. I'm saying that this was a predictable and inevitable consequence of the failure of the Tshwane government, the local government, to, since 2005, deal with an elementary aspect of municipal service, that is managing wastewater. The Rooiwal wastewater management system has been in a state of collapse since then. It was just a matter of time before deadly disease like cholera would manifest. And the fact that it does so in an industrial heartland of the country, outside the capital of the country, is such an indictment that it's gobsmacking. And the fact that all the politicians right now in that council are busy blaming one another, the ANC blaming the DA blaming the ANC, the EFF blaming both, while they were all there for the last 10 or 15 years while this was happening. And they were warned that this might happen and that they had to fix this very basic service. If you can't do that as a municipality, you should not be in municipal government. And I think just as a background to your question, I think that should explain things.
And I mean, it actually does date back to 2004 because SABC went to the area, has been investigating, just some of the concerns by residents. In 2021, in fact, we went to the timber treatment plant where we knew there were concerns both at that plant, which has now come out to say that the water that was tested now recently by the health department does not contain cholera. And it was discovered then, that a report in 2004 actually uncovered that if maintenance isn't done in some of these treatment plants, we will be sitting with a calamity. And I think it is safe to say that the death of 17 people is of concern, and it is really concerning that no one is taking responsibility there. But let's not talk about, just some of the concerns around the outbreak. We are understanding that it is spreading to other areas, including the Free State, some parts of the Western Cape. Just your thoughts and concerns around how this is actually now spreading to other areas.
Sure. I think that is also, again, quite expected. We have over 2/3 of our municipalities in this country whose water reticulation systems are in a state of disrepair, to greater or lesser extent, one from the other. But they are experiencing pretty much what Hammanskraal is now experiencing, the risk of these outbreaks. So we're seeing it in the Free State. We're sure that there's going to be other areas. It was present in southern KZN some time ago. And here's the thing, the only difference between an area that suffers this, apart from, say, a major natural catastrophe like an earthquake or flooding or so on, is the breakdown of water reticulation. So if your water is properly piped, and your wastewater is properly processed, You should never experience this. Now, this is an elementary thing, as I said, and this is happening across the country. And it won't be surprising to find other outbreaks occurring as time goes on. Now, it brings me to the second part of the concern here, and that is the clinical concern. You know, it's very likely that there are many more deaths that have not yet been recorded as due to this cholera outbreak in the Hammanskraal area. And the fact that we only have the numbers who are admitted right now may be a function of people not presenting themselves for testing or for care. And so, you know, the official records won't show that. But on the balance, with 17 dead and just over 35 documented cases, that's a 50% mortality rate. This is giving rise to great concern among clinicians and infectious disease specialists, saying that that's an abnormally high case fatality rate, when it should only be around 5 to 10%, which is what happens when there are outbreaks elsewhere. But I think a lot of that is probably due to the fact that we just haven't recorded the number of cases. But that must give you a sense of how widespread this problem really is. So we're facing a crisis that must be dealt with right away. There's no point in prevaricating. There's no point in blaming each other at this moment. We are in an emergency situation. That water reticulation system in Hammanskraal must be urgently repaired. But what do we hear? We hear the local government saying they're going to negotiate with the national government about getting some extra money because their capex won't cover the repairs that are necessary. This is after 15 years. They are still saying this. So you have to ask yourself, who are they actually responsible to? Who are they pretending to govern here? Certainly not the people who are experiencing the death and the morbidity arising from this, because there's no connection between the two. And the reason for that is a simple one. These politicians are protected from having to be accountable by three things. One, that they are elected into office, and so it's very difficult to get a connection with the people once they are elected into office, as we've seen in not only in Tshwane, but around the country. Second, they are appointed by their own political parties. And therefore, to get direct accountability from the individual councillors is near impossible. And lastly, the government will fund their defense against any accusation that they were responsible. Here's the facts. They are responsible. They are responsible for the culpable. They are culpable for the deaths of all of these people. And it is time, as we saw in the Life Isidimeni matter, that a new pathway to make sure they account, a legal pathway, has been established. The Moseneke inquiry and now the legal inquest into the Life Isidimeni disaster is proof enough that this can be done. The families who are suffering right now from the loss of their loved ones will eventually come to understand that their deaths were completely preventable. Completely. There's no question about that.
All right.
And the people whose job it was to prevent it were missing in action.
Dr. Dasoo, thank you so much for your time and, of course, your analysis. Dr. Aslam Dasoo, and he is the convener of the Progressive Health Forum, just talking about this escalating cholera outbreak out in Hammanskraal. We obviously now understand that it is spreading to other areas of the country.